And you're currently going for your MBA. Do you have any long-term plans with your MBA, or does it just make sense? You're such like an entrepreneur that you're like, I will find a way to utilize this eventually.
So my MBA journey started because I feel like there is a bit of a disconnect at times between those of us that work on the floor and the business side of things in healthcare. And I feel like more nurses need like business, it's like speaking a whole nother language. So I think like having more nurses that can speak both languages, it's like when you have a person in healthcare that is bilingual that can help an entire group of patients that doesn't speak English.
Mm,
Sometimes like that bridge is needed and there needs to be more of us that are able to like cross that bridge when it comes to like direct patient care and the business side of nursing. So ultimately goal wise, my goal is to be able to help advocate for the nurses that are working in direct patient care and just anybody that's working in direct patient care as well as the patients, because I feel like nursing needs more of a voice. And I love the fact that there's so many nurses nowadays that are becoming more involved when it comes to legislature
yeah.
and just like everything in general. I feel like it's such a big deal. And I think that like that's what the future is for nursing. I've been in healthcare, like I said, for 20 years. So I've seen so many different changes that have occurred within healthcare. So kind of being able to advocate and also be that voice because the younger generation of nurses needs more nurses that are experienced. A lot of us, I feel like, left, after and during the pandemic. So
Mm,
having the nurses that have stuck around, that are willing to go and, be that voice for some of the less experienced nurses or some of the nurses that just aren't confident enough to speak up about some of the issues that we have in healthcare. Like my big thing is advocacy more than
yeah.
anything at this point, and being able to like sit at the table with the business people.
That was a great point. I couldn't agree more with you. I'm a huge advocate of advocacy. One of the reasons I love this podcast is I've had more and more nurses that I don't know reach out to me on LinkedIn with their stories of work of working at the bedside, or just telling me that they really resonated with the podcast and what we're saying on here. So I think that my path towards advocacy is getting like more and more prominent. I also plan on having a nurse that is focused on nursing-based legislature on. So that's
Nice.
another exciting thing. Yeah, she asked to come on, and I was like, yes, please. I have a lot of questions for you, and I'm very excited. So that's awesome that you're also going down that route. I think we need more and more nurses that are that can speak both languages, like you said.
Mm-hmm.
Um, so do you have any like parting words or best advice for nurses out there that either want to start their own business, whether it be a baking company, or might want to transition into a role that is like non-traditional, like an occupational health nurse in a construction industry, anything like that?
One of them is you can be anything you want to be as a nurse. Like
Mhm.
that's the thing is like we can wear so many different hats and like you're always needed. I feel like
Mhm.
we just get lost in translation at times. So like understanding like how important your role is as a nurse for the patients and for other nurses. I think is just it's absolutely incredible. Like we have the ability to touch so many people, and if you stop and think about it, people don't forget nurses, the good, the bad, the ugly, they don't forget us. We
True.
change lives, and like what we do is so incredibly important. And I think the other thing is like just keep moving forward. Like we're all going to have setbacks here and there. Everybody has like I've spoken to so many different nurses at this point that like one of the biggest mentors I have is one of the CNOs at one of the local hospitals, and she like always is so encouraging, and I think it's important to like make sure that we stick together and we are always encouraging one another even
Mhm.
on like the small things that we decide to do.
That's
um
okay. Love it. Keep up, keep going.
but just like taking the time to like nurture one another. When I started nursing, there was a whole lot of the nursing that eat their young, and I was
Yeah.
eaten and regurgitated several times.
Oh,
um just making sure that like we take care of each other, because at the end of the day, like we take care of the world. Like if you stop and think about it, we take care of the entire world. So if we do not take care of each other, there's nobody to take care of the world. So just it's important that we make sure that we take care of one another and have healthy outlets. Having time for self care is important. Taking care of yourself. I think that's something that we lose and we forget as well. So, taking the time at least even once a week to say, okay, this is what I'm doing for myself. It's
Yeah.
incredibly important so you don't get lost in translation and you don't lose yourself within healthcare and nursing. I think that's kind of it in a nutshell.
Amen. Amen. When I meet a nurse right away, I'm typically like, I'm the opposite of an eat your young type of nurse. I want to help you. I want to
So do
see
I.
you succeed. There are so many things that are stacked up against nurses, whether it's our 12-hour shifts that are like of our nightmares, or, just the world not quite understanding what we're going
Mm-hmm.
through, that the least I can do is support another nurse and let them know that they have an ally in me. And I'm just
Correct.
so committed to that message. And I'm seeing more and more nurses around me making themselves available. I don't know if it's kind of like you put your vibe out and your tribe kind of like comes around you. So I don't know if it's the energy that I'm putting out or if it's truly people getting so sick of the eat your young mentality that they're just trying to push back on it, because it serves no one. No one wants
Yeah.
to be bullied, especially in an industry that already has a shortage in some areas.
Mm-hmm.
Like, we're not helping anything here.
No.
I love that you said taking care of yourself in an outlet that's not nursing. I'm a huge proponent of hobbies. After this call, I'm heading to the gym. um, so I think it's important, whether it's active or if it's just hanging out and taking a bath. I'm also a huge
Mm-hmm.
proponent of being in warm water. Like,
Yeah.
whatever it is that you need to do to nurture your soul and feel better. Um, I definitely agree with taking care of yourself too. And that's going to be different for every person. Um,
I think every nurse should soak in a bath of like bath salts and eucalyptus once a week. Like
yes.
eucalyptus just it relaxes your entire body. And I think like just even doing something like that once a week or having like the little steam tabs that you put in the shower and taking
Hmm.
a longer shower and just breathing in all of the like nice warm eucalyptus is great.
Yeah, taking a second just to decompress.
Mm-hmm.
Yeah. Sometimes I don't notice how like clenched up I am until
Mm-hmm.
I like let go. And I'm like, ooh, like I need a second. I need a couple of deep breaths in the shower to just kind of like declench my entire body. All right. All right. Janella Woods, thank you so much for coming on here. I can tell that
Thanks
you're
for
going to make,
having me.
yeah, absolutely. Anytime. I can tell that you're going to make such a big difference in the nursing world. And through your baking, through your occupational health, and through your MBA, you're a nurse that makes our industry proud to have. So thank you so much for everything that you're doing out there.
Thanks for having your podcast. It's nice to have like a voice behind nursing and to see people that are wanting to bring everybody more together.
Absolutely.